On this episode, we sit down with Dr. Daniel Kertesz from the World Health Organization to discuss COVID-19 and pandemics in general.
So if you need some solid advice on how to cope, what to expect, and even some good news to look forward to, you'll love this episode of the Bangkok Podcast.
Sawadee krap and welcome to the Bangkok Podcast. My name is Greg Jorgensen, a Canadian who came to Thailand in 2001, never left, but who has never been to a full moon party. True story.
Wow, I've been to one.
Really?
And I met Kenneth, an American who came to Thailand on a one-year teaching contract 19 years ago, fell in love with hating those wooden frogs that make the ribbit sound when you rub a stick on their back. And so I never left.
You got to have something to focus your hate on.
That's right. That's exactly right. I hate those frogs. Before we start, a huge thanks to all of our patrons who support the show. Patrons get a whole bunch of cool stuff, including our regular show a day early, behind-the-scenes photos and videos of our interviews, discounts on swag, which you can find on our website, and various other things that aren't available to regular listeners. But best of all, patrons also get an unscripted, uncensored bonus episode every week where we riff on current events and random topics. We just finished recording this week's bonus show, and we did our usual coronavirus update, which we're really getting tired of, but it's necessary, plus ruminations on working from home with and without a kid during the lockdown, and some of the tools and strategy we use to keep productive and sane. To become a patron, head to bangkokpodcast.com/support.
Mostly sane. Very tired. Yeah.
Right.
All right, guys. Well, before we jump into it, I just want to mention here quickly, while we have the opportunity, most of us are probably stuck inside for a good portion of the day or week as we work through this coronavirus bullshit. But while we're doing that, I think the only people that are really holding the city together are the delivery drivers, the food drivers, the pizza guys, the people that are delivering stuff and packages and food all around the city. Tip generously,
For sure.
These guys are superstars, right? Like they're out there, the taxi drivers, the people who are still handing stuff off to people.
Yeah, it's their turn, man. It's their turn to keep the city flowing.
Yeah, that's right. We ordered MK tonight, and the guy came to our place, and and he was really polite, and I threw an extra 100 baht on top of everything. It's literally is the least I can do. So keep that in mind, and not to mention your guards too, your building guards, your condo guards. Those guys are out there keeping you safe, and they're not allowed to go home. So pass it on, pay it forward, as they say.
For sure.
Yeah. All right. Well, in this timely episode, we are very lucky to have as our guest Dr. Daniel Kertesz, the World Health Organization representative to Thailand. Daniel holds a master's degree in epidemiology and specializes in internal medicine and infectious diseases. He started his career as the chief of the Respiratory Disease Division at Health Canada before moving on to the World Health Organization, working in Africa for 20 years in Mali, Angola, Ghana, Mozambique, and Sierra Leone on immunization projects, as well as battling outbreaks of polio and Ebola. For the past 3 years, he's been based in Thailand, where he is now busy leading a team trying to fight back against the deadly COVID-19 coronavirus outbreak. So it was a real pleasure to sit down with Daniel. Super nice guy. He is Canadian after all, Ed, so that's kind of a given. But it was cool to meet him, and here is my conversation with Daniel Kertesz. All right, well, Daniel, thank you for meeting me. I know you must be very, very busy right now, but thank you for coming on the Bangkok Podcast and making time for us.
Thanks so much, Greg. Real pleasure to be here.
So it's a pleasure to meet you. Now, it was difficult to sit down. We've been trying to put this together for a week or so, and last week I'm kind of happy to report I got bumped for the minister of something or other.
You got totally stiffed. That's true.
That's right. But if I'm going to get bumped by anyone, that's a pretty good person to get bumped by. But we were able to finally sit down. We're sitting out here in a lovely outdoor cafe. We have not shook hands. We have stayed 6 feet apart, and we're sitting on opposite sides of a table right now, which is probably prudent. So look, I wanted to get someone on to talk knowledgeably about this, because this sort of this COVID-19 pandemic is something that it's affecting everyone in the world, and it's affecting Thailand, of course, too. So we're recording this on March 25th. Can you just sort of give us a quick rundown of what the latest is? There's almost 1,000 cases in Thailand now that have been reported. depending on who you believe. The standard advice is to stay 6 feet apart, don't go out in crowded places, wash your hands, wear a mask. Is there anything new to add to that, or is this sort of standard information?
Greg, you sound like you don't believe.
I've been here too long to believe what I'm told. I don't know what to believe.
Sir, I totally understand. It's confusing. And I think we are all living history right now. An event like this hasn't occurred for over 100 years. We haven't had an infectious disease event like this for over 100 years. It's completely understandable, the anxiety and concern that is spreading around the world as fast as this virus is spreading. This is a true pandemic. Almost every country in the world is now affected by this. Thailand was only the second country in the world to identify the virus causing COVID-19 after China, but it has since spread around the world. And as we speak, the epicenter of the epidemic appears to be Europe, where they're still battling with an increasing number of cases over there. So yes, we are living history here. And having said that, and recognizing that this virus is spreading around the world, not all countries are affected in the same way. And the WHO, World Health Organization, looks at countries from the point of view of the progress of the epidemic. We consider countries in three categories: cases, clusters, and community. Okay. And maybe I can just say, when countries first import a few cases, and that's really sort of the first stage. And there are still some countries that have just seen, importations of cases. And then what tends to happen is the virus tends to begin to circulate locally, but in clusters. That is, in a situation or a context where you can identify where the virus is, who the virus came from, and infected individuals. You can link them back to events or other individuals.
Like a kickboxing match, for instance.
Exactly. Or a pub, or a traveler, or right. Something like that. And then the third category is what we call community, and that's when you have transmission in sort of widespread transmission in the community. When cases occur, you don't really know where they came from. You can't really trace their origin. You can't link them to anything. And it's really important to understand that difference, because in a country like Thailand, I think what we're seeing now is we're seeing evidence of community-based transmission here in Bangkok, and recently sort of exportation or importation of cases into the provinces. So there are a lot of provinces that are now reporting cases in Thailand, but they're only reporting sort of, some of them are, most of them I think at this point are reporting under sort of 20 cases. And it's important to make that distinction, because the approach is different. When you have sort of cases, sort of imported cases or a few cases, it's possible to sort of get on top of it with a good public health response. And by that we mean testing, isolating the cases that you identify, identifying their contacts, tracing their contacts, just to make sure that the infection is that transmission from person to person does not continue. So if you have a few cases, it's easier. It's possible to get on top of it and sort of slow it down a lot, or even prevent it.
Right.
When you have cases in the community, it's much more difficult. It becomes more difficult in that situation.
Yeah. So can you talk a little bit about your job with the World Health Organization in Thailand? What do you do normally, and has that changed now that this thing is sort of sucking up all the energy from everything?
Yeah, I think everything has changed. I mean, we, our office has been here in Thailand for many years. We have a close collaboration with the Ministry of Health. My office is embedded in the Ministry of Health. So we work very closely with colleagues at the ministry. And, prior to COVID, our collaboration had been around things which are of concern in Thailand: non-communicable diseases, the whole issue of road safety. We work on migrant health issues.
Right.
We work a lot on international trade and health, so how international trade issues affect health. But since early January, we've been repurposed, and we're working now almost full time on the COVID response.
Right. What's your staff like? What are they?
So I have a really talented group of international professionals, a mixture of international professionals and Thai professionals. So I have about 10 professional officers and also a very good administrative team. So we're all, again, repurposed and working very hard and
Right.
bringing all our different perspectives and experiences into this, which I think has been really positive.
Right. So one of the cool things about having you on is, I don't want to get into the same old. There's so much information out there online, and
Sure.
there's so much misinformation
Yep.
as well. And in fact, I just before we started recording, I showed you a flowchart that I saw on Twitter, and the first bubble said, "Am I a COVID-19 expert?" And there was one arrow, and it led to another bubble that said no, because there's so much going around out there. So I kind of want to stay away from that, because I think everyone knows the general rule right now, especially there's been an emergency declared in Thailand. Stay inside as much as you can, stay away from large gatherings, wash your hands, all that stuff, like I said, I think everyone knows. So I want to focus on maybe more specific questions from myself and some of our listeners, and some of the questions that I have that I haven't really got an answer to from the information that's available out there. So first of all, I've heard talk of some reinfections, and I've also heard talk of herd immunity. But if people can get reinfected, doesn't that sort of dispel the notion of herd immunity and how that works?
Greg, I hope I'm going to be able to answer some of your questions, because they're really good questions.
Oh, thank you.
One of the challenges is that we've only known about this virus for about 10 weeks. And, there are still so many unanswered questions. And I think the question that you've just asked me is one of those questions that we just don't have the answer to.
Right.
So herd immunity is really the idea that when enough people in the population are immune, either from having had an infection or having been vaccinated in an infection, that the disease has no home. If the disease is transmitted from person to person, it has nowhere to go because so many people are immune. And it basically means that those people who are not protected, who are not vaccinated, who have not had the disease, are sort of protected because the vaccine is not circulating widely in the population, because so many of the population is protected.
Right, the disease is not.
The disease is not circulating, yeah. So in a way, the few are protected by the many. You
Right.
could consider it that way. So we don't know how much herd immunity will contribute to changing the course of this epidemic. We don't know. And we don't know, actually, if people who have been infected can get reinfected. I mean, it's possible. There are a number of scenarios. It's possible that they could, but that the infection would be less severe. I just think only time will tell. And, the lucky thing is that we have a lot of people interested in this disease and a lot of people wanting to answer those questions. So
Define interest.
Yeah, so stay tuned. I think this is just such an area. It's just such a fascinating, from a scientific perspective, to have something like this happen with such urgency and to have so much unknown. It's just for curious minds. It's
well, that's something I wanted to get into too. And for someone like you who deal with this kind of stuff all the time, for me, it's very easy to get caught up in the emotion and drama and tragedy of it all. I mean, people are dying, families are very, being affected in terrible ways. But if you turn that off, if you turn off the emotion and the reality part of your brain, look at it from a purely scientific or historical perspective, this is a really, really fascinating thing that's happening medically, culturally, financially, societally. It's an incredible thing to watch. It's also an awful thing to watch.
I think you're right, but I think it's extremely difficult to turn it off. I mean, I go to work every day, and I have a family. I have 2 kids, and I think about them. I have 2 elderly parents back in Canada. I think about them. You just get through every day, as we all do, just by focusing on what you're doing. Focusing on what's right in front of you, and again, just trying to solve problems, which is, and I think, like I said, this is just such a, it's just presents there's just so many interesting unanswered questions. I think one of the really amazing things or interesting things is that, while this is, as I said, a once-in-a-generational event and really quite terrible. The world is really set up as it never has been before to answer some of these questions. We have networks of collaboration between clinicians, doctors, nurses, epidemiologists, between infection control practitioners, scientists, laboratory experts, all working together in networks that didn't exist even a few years ago, trying to solve these problems. So in a way, I from my perspective, really some of the greatest minds on earth are bearing down on this problem, and hopefully we'll have some of these questions solved.
Right. And I mentioned earlier that we haven't seen anything like this in about 100 years. I'm assuming you're referring to the Spanish flu of 1918?
Yeah. Yep.
Probably. Now that one exploded and then went away and then exploded again. We see right now in the past week or so, a lot of people in China are sort of cheering, reporting no new daily infections or no new people showing symptoms anyway. Couldn't it all just, and they're starting to reopen movie theaters and they're going to start letting people come outside again. Couldn't it all just explode again?
I think one of the unanswered questions is there some sort of what we've seen is that the places where this virus has really had a big impact have been in northern sort of temperate climates. Climates that typically have a severe winter flu season as well. So it's an interesting hypothesis that that the impact of this virus on humans might be related to climate. I think that remains to be seen.
Right. There's a lot of debate over that.
There is a lot of debate over that.
And these heat band maps and things
right.
like this.
Yeah. Again, it's we're still so early in this epidemic to really to be able to say whether or not that's true. But I think it is something to keep an eye on. But it's true that we might expect fluctuations in the disease. It could come and go. That will depend on susceptible populations. It will depend on what we've just talked about, the concept, it will depend on what kind of immunity humans build up based on infection. It'll depend on drugs and therapeutics and an eventual vaccine that might become available. So the course of this is very difficult to predict, I think, going forward. But I think, all our lives are going to be changed by this for a little while, because, we're going to have to, observe the kind of social distancing measures that we've seen put in place, and I'm not saying the institutional ones, but the ones that we do as individuals. So, keeping our distance from people, but also, we'll all be paying a little more attention to washing our hands regularly, using alcohol-based hand rubs.
Tell me about it.
The way we sneeze and cough. Yeah, are your hands as dry as mine? I'm not sure.
Yeah, I've washed my hands more in the past couple of weeks than I have in my life.
And, we'll all be, paying attention to the way we touch our nose and our mouth, and you know what? That's not a bad thing, because, these kind of basic measures prevent us from will protect us against many other infectious diseases, common infectious diseases that we see, including things like the flu.
I think you tend to get sort of like lackadaisical about it, like, I don't need to wash my hands.
Absolutely. Yeah. Yep.
Yeah, it's good advice. Now let's talk about Africa a little bit, because you spent 20 years in Africa dealing with inoculations and vaccinations and Ebola and malaria and a lot of these sort of serious outbreaks of things. I read something that said that as of now, as far as I know, infections in Africa are fairly light and or just not reported yet. But one thing I read that was quite interesting that said that Africa's sort of in a weird position, because the populations are very used to these kind of things, these sort of like pandemic or epidemic outbreaks. So psychologically, mentally, culturally, they know how to handle them. But medically, the systems are not in place to handle them. So what happens there?
I think yes and no. I think people in Africa have been living with communicable diseases for a long time, and they're still living with some very serious ones, like malaria, for instance.
Right.
That doesn't mean that when something like this happens, I think populations are afraid and they are worried, and this does affect them. And I think one of WHO's big concerns is, we've seen what this virus can do in health systems that are well developed. obviously, we're extremely concerned about what could happen in health systems that are less well developed, where there's less capacity for treating patients who need more intensive support, where there's less capacity for this public health response that I mentioned before, that is less capacity to get on top of chains of transmission and prevent the virus from spreading. So I think, it is of... I think that we're watching very closely what's happening in countries where health systems are not as well developed and trying to support them.
A few days ago, there was a story in the Bangkok Post, and I'll quote it. It said, "Widespread transmission will slow down in Thailand until the number of infected cases per week peaks between January and February next year. At least 400,000 people will be diagnosed with COVID-19 this year and next, with the peak period expected to be during the next cool season," according to Sopon Ayam Samaton, chief of the Communicable Diseases Division. Is it realistic? Is it hard to predict that? Is that just a guess in the wind?
So these are models, and I think models are interesting. I think what's really important to understand is that what happens with this virus, the trajectory of this virus in Thailand and around the world, depends on what we do. Depends on how we intervene to stop or slow transmission.
Right.
So again, there are a number of things we can do. If we have a good public health response that can identify cases, trace contacts, prevent cases that have been identified from transmitting to other people, we can slow this down considerably. If we put in place comprehensive social distancing measures where there is community-based transmission, where it's very difficult to identify where cases are coming from, when you have a few cases and they're associated with clusters, we talk about separating the virus from the people. But when you have community-based transmission and you don't know where the virus is coming from, you have to separate people from people, and that's really where we are now. But if you can do that effectively and keep people at an appropriate social distance, prevent them from gathering in crowds, and limit the opportunities that they have to transmit the virus from one to the other, you can alter the trajectory of this. And the whole purpose here, why that's important, is we want to keep the number of cases at any one time below the capacity of the health system to manage them. The danger is if you have a sudden increase or a sharp increase in the number of cases, you quickly exceed the capacity of the health system to deal with them.
And this is where the whole flatten the curve thing comes.
This is the whole flatten the curve thing. The curve is the number of cases over time. So if you can flatten the curve and keep the number of cases happening at any one time within the health system's capacity to manage them, then you're much better off.
Right. So is Thailand doing the right thing then in sort of this emergency, declaration of emergency, the social distancing? Are they not doing enough? Should they be enforcing curfews? What's going on here?
So I think that, we've been working, like I say, I've been here for 3.5 years in Thailand. We work very closely with colleagues from the Ministry of Health. They have an extremely strong team. And as I said, they were the second country in the world to isolate the virus. And for several months now, with a very strong public health response, they've been able, I think, to manage the number of cases. They've been able to identify chains of transmission and stop them by isolating cases and tracing their contacts. I think recent events have led to an increase in the number of cases. It's pretty clear now that we have more widespread transmission in the community here in Bangkok.
Right.
And I think that's where these social distancing measures become very important. I think that there are really two ways that we can think about social distancing. One is the social distancing that individuals can do, like you and I are doing right now. You're sitting across the table. We're aware of the fact that we need to keep a social distance. We're keeping our hands clean. We're practicing good respiratory etiquette. That's really helping to if people did that, and people did that regularly and consistently, that would really slow the transmission. Right. The other social distancing measure is these kind of institutional social distancing measures that banning sports events, recommending that no more than 3 to 5 people meet at a time. I think that these things are becoming more critical and necessary. We absolutely have to flatten the curve here to prevent the health system from getting overwhelmed and prevent unnecessary deaths that might arise if we don't have beds for people who need them to survive.
Right. And speaking of this, one of the sticking points here seems to be the whole thing about respirators. Now, why are respirators so difficult to make? Can't you just sort of like turn on a production line and have the machine spit them out? What's the holdup?
Yeah, it's a little more complicated than that. It's you're right. A respirator is a machine, and machines can be made and produced, and but there's issues around. I mean, there's a huge demand now around the world. I think it's really important to understand that no health system is purpose built or built for this kind of event. So, there isn't a country in the world with, 100,000 respirators sitting around waiting, or a factory in the world with respirators sitting around waiting to be distributed. So, yes, that would be possible. But it's not just, it could be possible to ramp up production of things like ventilators, which incidentally are used to support, to help people who can't breathe on their own or have difficulty breathing on their own as a result of infection for a limited period of time. So, but it's not just respirators. It's an intensive care treatment setting. So you have to have the ventilator, but you have to have properly trained staff. You have to have beds. You have to have IV equipment. You have to have personal protective equipment. There's a whole bunch of things that go with providing intensive medical treatment to people with severe COVID infections. Right. So it's not just a matter of scaling up one thing. It's a whole package. And I think a lot of countries now are really trying to scale that up. Countries are trying to repurpose their staff, retrain their staff to get them more familiar with working in an intensive care setting. Countries and hospitals and institutions are trying to procure personal protective equipment so their healthcare workers are protected, but it's not something that can be done overnight.
Right. One question that I have is I live in a small to medium-sized condo with my wife, my son, and my mother-in-law, and sometimes my wife's sister who stays with us sometimes. My life is a sitcom. But say, if I bring it home or my wife brings it home, we've all got it. Basically, it's pretty difficult to escape that because we live in such close quarters. So if that's the case, hypothetically, can we all self-quarantine together? Do I have to go and get a hotel room, or does she have to go get, how does that work?
Are you trying to get out of your family obligations? Or
what I'm saying here, Daniel, is I would really like time in a hotel room with my PlayStation for 2 weeks.
Right. So that's a reasonable question. I think I think that people who do not have symptoms or asymptomatic, there's a lot of recent controversy about people who don't have symptoms, because a lot of people with very mild symptoms or no symptoms at all are identified as having COVID. And the big question now is having the virus that causes COVID, because COVID is the disease. It's the syndrome. The virus that causes COVID is the virus that causes the disease. So there's a little bit of a difference, but many people are found to have the virus without actually having any symptoms of the disease.
Right.
So the question is how effective are they at transmitting the virus? And we still think, and this may change, but our current thinking is that it's really people who are symptomatic, who have symptoms, cough, fever, chills. It's really those people who are most effective at transmitting the virus. So this comes back to your question, and that is really, if you're asymptomatic, you're probably not a big risk to those around you, okay, including your family. The really critical thing is to isolate yourself as quickly as possible from your family, from others around you, the moment that you develop the common symptoms of COVID, okay? So if, the moment that you develop fever, cough, shortness of breath, chest pain, this is the time to put on a mask and move yourself away from people around you and seek medical attention right away. So I think that, and that's, that the faster that people can do that, obviously the less the possibility that they will transmit this to others, and the less the possibility that this virus will propagate. I'm not sure if that answers your question, but it basically, if you're not having symptoms, you're probably not infectious.
But there's a lot of people that can't. Like, say I become infected and I test positive. Okay, I like I said, I live in a small condo. I can't go into the bedroom by myself for 2 weeks. can I check into a hotel? Is that even legally allowed if I know I'm contagious?
No. Basically, what you would do is you should go and get tested, and then you would be admitted, and you would be admitted to a hospital, and you would be isolated. Okay, you would be put in an isolation room for as long as it takes for your symptoms to resolve and for you to have 2 consecutive negative tests over a 24-hour period.
I see.
That would be about 2 weeks. But the current protocol or recommendation here on this day, the day that we're talking, is that if you test positive for COVID, you're admitted to hospital and
Okay.
put in isolation. Now, in some parts of the world, that's not possible, or and they're opting for they're opting for home care for COVID patients, and WHO has guidelines for that, but it's not as effective in sort of slowing the transmission of the virus as isolating people in a facility.
My buddy Matt tested positive in Austin, Texas,
Right.
Texas, and he's been at home by himself for a few
Right.
weeks, and I think he's
Right.
getting better now.
Sure.
So he was luckily a mild case.
Yeah, I mean, I think that is definitely an option, but you are right that if you live with a lot of people in a small home, if you're positive, even with the best instructions and the best support, it's possible that you could transmit to the people in your house, because this is a disease that transmits itself between people who are in close contact with each other.
Yeah.
Okay, living together, healthcare workers who are looking after patients. It's a disease that moves between people in close contact.
Let's talk a little bit about vaccines. I hear anything from, it'll be something will be ready in 8 months to 18 months. I know there are many teams around the world that are working really hard to come up with something. Any insight you can give into that?
Yeah, I mean, I think there are quite a few what we call candidate vaccines currently under development. And I think that it's probably going to be within the year that we have a vaccine available. How effective the vaccine will be, we're not sure. But so for me, the issue is less about having a vaccine, which I'm sure we will have, but it's about then ramping up the capacity to produce the vaccine and in sufficient quantity that it would be sort of available to everybody, and that might take a while, and there would have to be some prioritization of who would get the vaccine. It would be more vulnerable groups, healthcare workers, in much the same way that limited vaccine when we had the 2008 flu pandemic, that initially when vaccines were in short supply, we sort of prioritized their distribution to those who were vulnerable or who were at special risk. I actually think, Greg, that the most promising thing are therapeutics. And there are many drugs that are undergoing clinical trials now, accelerated clinical trials, and by that I mean sort of testing against what we call standard of care. So the whatever is the kind of support that people are currently getting. So testing drugs against what the current standard of care is, and if we can identify drugs or therapeutics that reduce the severity of infection and the overall mortality, I think that will be a huge breakthrough.
Right. So fingers crossed.
And probably would be available sort of at a more. Probably would be available more quickly than would a vaccine.
I would hope so. Yeah, they make special cases to get this stuff out as quickly as possible. Well, before we get into some questions before we finish it off, let's talk silver linings. You mentioned earlier that there are tens of thousands of people around the world working on this. 2 months ago, it was sort of a fringe topic. We barely knew anything about it. Now the entire sort of global industry is focused on it. We know more than we ever have about how these things work. So we are in a good position as compared to, say, 50 years ago, 100 years ago. So what are the silver linings here? Give me some good news.
I know it's hard to find good news here. You certainly don't. It's hard to find. You certainly don't see it when you look online. But in a way, again, 12 weeks ago we knew almost nothing about this virus, and that the genetic sequence of this virus was done in a matter of days, and by the Chinese who shared it. And that is a process that 10 years ago would have taken months, and it's inconceivable. Would have been inconceivable years ago, and I think the advances in technology, advances in communication, advances in networking, the full intellectual resources of the world, I think, are being brought to bear on this. And I think for that I'm positive. There have been must be over 200 now peer-reviewed papers in journals published about this. We're getting new studies every day. Again, we talked about vaccines. There are candidate vaccines in the works. There are trials ongoing, testing of new drugs and therapeutics. So I'm hoping we'll have answers to these things very quickly. But it doesn't make it easier for people, and I think it's hard to find silver linings. But I think much better this is happening now than 10 years ago.
Yeah. How do you keep positive? You seem like a pretty happy guy. I mean, you're Canadian, so you're obviously automatically a pretty decent human. So, but
does that make me automatically happy? Automatically polite.
Yeah, that's right. That's right. Well, it's in our Constitution, our Bill of Rights, I should say.
Right.
But you must have seen some horrible things in the course of your career, and you have a family. What do you tell your kids? How do you keep an even keel?
Yeah, it's not easy sometimes. I mean, you just have to keep focused, and I think knowledge and understanding helps deal with the fear. The more you can understand something, and the more you can conceptualize it, the less afraid you are, I find. And I'm in a really lucky position in that I have access to a lot of knowledge and a lot of understanding, and that helps me sort of put things in perspective, and it helps me manage I think it makes me less afraid. And I like I said, I think it's really important just to focus on, at my office we just try and focus on the problems that we have to solve every day. On solving issues that come up. I think it's just a matter of taking it day at a time. I agree, it's hard to talk to kids about this. Schools have been canceled. My kids love going to school. It's really hard to explain to them why they're not in school. They've heard about the coronavirus. Every time something happens in the house, my son says, "Dad, is that because of the coronavirus?"
Yeah, my 5-year-old knows the word coronavirus. That's messed up.
Yeah,
you shouldn't have to.
No, my kid's telling me what it looks like under a microscope, and I think, okay, cool. So, but I think I think we just have to explain this to our kids. We have to explain this to people. We have to help people understand, because again, I think understanding helps to dispel fear.
Right. All right. Well, I asked our lovely patrons who support the show for their questions. So if you don't mind, I'd like to get some questions here. So our buddy Jeremy says, will we ever get a lid on these, or is it just a cycle of pandemic, panic, solution, relax, rinse, repeat? So just going to keep going
You
forever?
mean for COVID or for bugs in general?
In general.
Yes and no. So there will continue to be epidemics, and there will continue to be pandemics. How often they occur, we don't know. As we, this is a zoonotic infection, and a zoonotic infection is an infection that has its origin in animals, in vertebrate animals, and somehow makes the jump or the transition to being able to infect humans. So, as we continue to be in close contact with animals, and as bugs and germs, they mutate, they change their genetic makeup. It's possible that we will see these events in the future. It's probable. In fact, it will happen. The question is, how will we be prepared for them, and how will we be able to manage them? And I think one of the lessons that will be learned out of this pandemic when all of this passes, and it will pass, is that we need to continue to invest more in preparedness and the kind of networks that I was talking about, and strengthening our capacities to collaborate around the world, so that when things like this are identified, they're identified quickly and we can get on top of them very quickly. So I think investing in preparedness, investing in the capacity of health systems to respond will be something that's really critical, and I think we'll be seeing that for a long time when this is all over. We'll be seeing an emphasis on that for a long time when this is over.
Right. All right, Greg. I like that name right off the bat. Not me, someone else. He asks, what are your greatest concerns moving forward? What are the best course of actions to deal with these kind of issues? What keeps you up at night?
You mean moving forward in this epidemic or moving forward in general in life?
I think probably this epidemic. Let's focus on this one.
No, I think right now our major concern is flattening this curve. Okay, so it's keeping...
So it's not just a trending hashtag.
Yeah, so we know that the health system... Exactly.
Yeah.
We know that the health system in Thailand has a limited capacity, as does the health system in every country. There are a limited number of beds. There are a limited number of... There's a limited capacity in Thailand, as in all countries. And we just have to do everything we can do right now to make sure that transmission of this virus is slowed down, so that the health system capacity is not exceeded, because that's when you have unnecessary deaths. And the whole purpose of this exercise is to prevent unnecessary deaths. So right now, our focus is on, looking at things that we can do and advocate for that flatten the curve. So that's our immediate That's our immediate concern, and I think that's also the concern of authorities in every sector in Thailand.
Right. This is an interesting question from Troy. He says, what aspects of Thai or regional culture does the World Health Organization have to consider when planning for pandemic spread or treatments? Some examples that come to mind: multi-generational living arrangements, tight living quarters, government decision process, Buddhist water bathing burial ceremony, lack of resources, income for a meaningful percentage of the population.
Troy, all of the above. I mean, I think that's, I think we don't fully understand what we call the transmission dynamics, or how this virus is transmitted. We don't fully understand all of the factors. Cultures are different. Cultures are different in especially in things like social distancing, and we don't know how cultural practices of physical and social distancing will change the dynamics of transmission of this virus. So I think you're quite right. People living together in close quarters with limited social or physical distancing, in conditions without access to running water, in conditions where there might be malnourished children, other comorbidities, other diseases. We don't know how the virus will act or what impact it will have on those populations. I mean, again, that's one of the things that we're concerned about and obviously looking out for.
Right. So the last question is from both Wes and Greg, and they ask sort of like, without a working vaccine, aren't these exercises and social distancing and other types of quarantining just temporary? I mean, it seems like sort of a low-tech way to tackle a high-tech problem. Is that all we can do without a vaccine? Is that the best thing we can do?
Low-tech is great in this context. Yeah. So, the most effective measures are the most basic measures. Washing your hand, sneezing into your sleeve or tissue, then washing your hands afterwards, not touching your nose or your mouth. Keeping a distance of 1 meter away. These low-tech things will go a huge way to preventing individual people from getting infected. And if individual people cannot get infected, you slow or stop transmission in the population. I did a Thai PBS interview about 2 weeks ago, program, and the byline of the program was COVID-19, no one is safe. And I suggested to them that, that your byline should be that no one is helpless. We all can do something to protect ourselves and those around us from COVID and other infectious diseases using these basic measures. That's one of the most important messages coming out of this, is that we all have a personal responsibility to slow down the transmission of this virus.
Right.
And, one of the, there's a lot of talk about, I've seen a lot recently about young people feeling like, they don't really have to, these measures are not particularly relevant to them because, they tend to get mild illness or the illness in younger people tends to be less severe. That is true. That's what the data are showing currently. But it's super important that we think about the vulnerable people amongst us. So while you may not be particularly susceptible to a severe disease, severe COVID-19, the grandmother or grandfather that you live with, the person with diabetes or hypertension that you live with will be. And we all have a responsibility to protect those people around us by not getting this infection.
Right. Well, a final thought before we go. I heard something really stuck with me a day or two ago, and it said, this virus doesn't move. You move. And when you stop moving, the virus stops moving. And I think that's something we all need to keep in mind. If and of course I've seen these memes of, our fathers and grandfathers, their sacrifice was storming the beaches at Normandy. Our sacrifice is sitting on the sofa watching Netflix. So I think we're doing pretty good.
Make no mistake, Greg, this is not easy for anybody. This is not easy for anybody, but you're right. If we can stop giving this virus to each other, it has no place to go,
right.
And it dies. So that's what we all need to be doing, is focusing on what we can do as individuals to protect ourselves and the people around us.
Right. All right, Daniel, thank you so much for coming on. I really appreciate your expertise and your insights, and thank you for making time for me.
Such a pleasure to be with you, Greg. Thanks so much.
When all this is over, how about we go get a coffee at Tim Hortons or something like that?
Is there one in Bangkok? I'm not sure.
Yeah, last week's show, we did an interview with the CEO of Tim Hortons. There's starting to sprout up. There's going to be, I think, 7 by the end of the year or something.
Okay, like you're on for that. I'm there.
Sweet. Thank you so much.
All right, take care.
Wow, man. All I can say is I'm happy that the people at the WHO, they just sound calm and reasonable and educated and scientific. I guess that's what we want, right?
That is exactly what we want. Yeah. It was super cool to sit down. Daniel was a really nice guy, just very laid back and cool. And you're looking at him like, I'm thinking like he must have seen some horrible stuff in his life. Like he knows how bad things can get. And he's still just like, hey, all you can do is learn as much as you can and apply logic and reason and science to it and make the best decisions you can with the information you have. And you're like, damn, that's all you can do.
Here, man. The bottom line is I don't know if I want them to be in charge all the time, but when there's an epidemic or a pandemic or whatever you want to call it, you just need calm, reasonable people who are focused on the evidence and who have expertise. It's like the one thing I hate about the modern era, and I think it's one of the downsides of the internet, is that every idiot thinks that they are an expert. You know what I mean?
That's right.
I will confess that I sometimes play that role where I read about something for 15 minutes and then I think I know what I'm doing.
Yeah. Well, as you heard in the interview at the beginning, I showed him that flow chart I saw, which we've included in our weekly package of pictures that go out with our episodes for our patrons. But it was the one bubble that said, "Are you a coronavirus expert?" And it had one arrow going to another bubble that said no.
Right. So it's just. There are certain times where you just need real experts. Like if you look at that guy's resume and his experience, it's just he's the real deal. So he's the guy we want to listen to. Exactly.
Yeah. So Daniel, thank you so much for sitting down with us, man. It was really cool to meet you and hearing about your stories and your expertise and your advice. And like I said, man, when this is all over, Ed, you and me are going to take Daniel out for some Tim Hortons, introduce you to some Canadian goodness.
For sure. Let's do it.
Yeah. All right, let's get into some love, loathe, or live with, where one of us picks a particular aspect of life in Bangkok, which we then discuss and decide if it's something we love about living here, loathe about living here, or have come to accept it as something that we just need to live with no matter how we feel about it. And this week, it is your turn, man.
All right, I got a scenario for you. I guess I'm guessing this has happened to you at least once, if not many times.
All right.
Here's a situation. Let's say you've got a Thai friend, a girl. You meet her, you're hanging out with her, and she introduces you to someone else, another girl, and she says, "I want you to meet my sister."
Oh, dude.
And,
So
and
funny.
you're like, wow. So you meet her sister.
I know exactly what you're talking about.
And then 2 years later, you figure out they're just friends.
Yes.
But you, like, in your head, you've been thinking like it's her actual biological sister.
Dude, I know this so well because I met a friend of mine, my friend Toon, who ended up being a long-term girlfriend of mine. We dated for like 3 years. This was a long time ago. And the first night we hung out, she was like, "These are my sisters, Duk and some other girl." And I was like, "Oh, okay." So then like months go by, we get together, we're dating. And then like a year into the relationship, I've only ever met one of her sisters. And I'm like, "What happened to your other sister?" And she's like, "What are you talking about?" I was like, "Well, the first night we met, you said you introduced me to both of your sisters. And I've never seen the other one." She's like, "No, I only have one sister." It took me like a year to figure that out.
That's exactly right. It's yeah. Now, listeners, in case it isn't clear, what we're talking about is that in Thai culture, I wouldn't say it's super common, but it's fairly common for Thai people to refer to their good friends as brothers or sisters.
Or
like,
people in their family or cousins as brothers or sisters.
Yeah, that's right. Even cousins, like people who are like, it's weird. So they introduced someone as their sister, even though it's just their friend. It's like it's almost like in Thai culture, what they really mean is the person is a really good friend. So it's like they move them across the line into the sister category,
Which is weird because Thailand has very specific names for specific people and their place on the family tree.
That's right.
We say grandparents, and it can be like your mother's side, your father's side, or whoever. But Thai language has specific names for whether they come from your mother's side or your father's side. And then you get into this. So it's super specific, but then they just
they're
throw
older
all that,
or younger. Yeah.
Yeah. And then they just throw all that out the window and it's like, "Yeah, he's my brother." You're like, "Well, no, he's not." So I need some clarification here.
This caused me a lot of confusion, like in the early days, where I just realized Thai people are really loose with that term. So now, if someone introduces them as their sister, I don't question them at that moment. I just roll with it because I don't want to be rude. But then later, I'll ask them like, "Hey, is that your real sister, like your biological sister?" I'll ask them later. So, dude, what do you think, man? Love, loathe, or live with?
You know what? I love this. It's confusing as hell, and it takes a long time to get used to, but I think it's a super charming, funny quirk of Thai culture that I like. Yeah.
All right, I'm going to go. You're absolutely right. It is cute. It's cute. It's charming. But I don't know, man. I'm going to go live with. It's just I feel so misled, and for me it's too confusing. Like, why don't they just say, "This is my good friend"? Like, just say, "This is my best friend. This is my bestie." Why do you have to say, "This is my sister"? So I'm going to go. It's definitely not a loathe. I don't hate it because it is cute. It's adorable. It's charming. I'm going live with.
Live with. All right. Fair enough. It's certainly confusing. We can agree on that.
All right.
Good one.
The final thanks to our patrons who help keep the show ad-free. Patrons get a ton of cool perks and the warm, fuzzy feeling knowing that they're helping support the show. Find out more by clicking support on our website and connect with us online. We're Bangkok Podcast on social media, bangkokpodcast.com on the web, or simply bangkokpodcast@gmail.com. We love hearing from our listeners and always reply to our messages.
Yeah, you can also listen to each episode on YouTube. You can chat with us online. You can even reach out to me directly on Twitter, where I am BKK Greg. So thanks for listening, everyone. Keep your masks on, wash your hands, stay safe, and we'll see you next week. Widespread trench. Jeez, it's been vodka.
Yeah, right. I hear you.
It said